All right, so now we move on to Module 50, and we're going to look at 3 other approaches to the treatment of people with various disorders. In this module, we're going to look at the humanistic approach, the interpersonal approach, and then the group approaches to treatment. So that would be like group therapies. So there are 4 questions that we're going to answer in this module. The first one, what are the humanistic approaches to treatment? Second one, following along the same way, what is the interpersonal approach to therapy? What is interpersonal therapy? And then the third one looks at, we're going to distinguish the difference between group therapy from individual therapy. And then the last question we're going to ask is, how effective is psychotherapy? And which of the psychotherapeutic approaches works best in a given situation? So those are the 4 questions that we're going to answer in this module. So let's start out with humanistic therapy. It is a type of therapy in which the underlying rationale is that people have control of their own behavior. They can make choices about their own lives, and they are essentially responsible for solving their own problems. So the humanistic therapy approach is that you have control over all of this. You may have this disorder and you may have these maladaptive behaviors, but you have control over changing it. You have control over making a new plan for your life, and this is what you're going to do. That's the humanistic approach. So these therapists believe that people naturally are motivated to strive for self-actualization. They believe that everyone wants to be the best person that they can actually be, and that is what they base this on. What we mean by being a self-actualized person is, this goes back to Abraham Maslow, and we talked about Maslow's self-actualization. Well, we talked about Maslow's hierarchy of needs in a previous chapter. But Maslow, self-actualization was Maslow's term for the state of self-fulfillment in which people realize their highest potential in their own unique way. You realize what you are capable of, where you are now, and what you are actually capable of. And you realize what you need to do to get to that self-actualized situation. So the humanistic therapists, they actually view themselves as kind of like guides. So they guide the person into really realizing this self-actualization, or they facilitate their thoughts about getting to be a self-actualized person. Now, we have 2 different types of therapeutic approaches with humanistic therapy. The first one is person-centered therapy. This is therapy in which the goal is to reach one's potential for self-actualization. It's also referred to as client-centered therapy. Person-centered therapy is when someone has the goal of reaching their own potential, also referred to as client-centered therapy. This was established by Carl Rogers, and he called it unconditional positive regard. That is where you are providing wholehearted acceptance and understanding and no disapproval, regardless of the feelings and attitudes the client expresses. Unconditional positive regard. Unconditional means that no matter what, you feel the same way about this person. So unconditional positive regard means that you, as the therapist, you are going to provide this unconditional positive regard regardless of what the patient or the client tells you. They could say the absolute worst thing possible, and you're still going to think and bring it into a positive situation. It does not necessarily mean they approve, but it's unconditional. So the therapist is communicating to the client that they are caring and non-judgmental, and that they can be empathetic. They understand the client's emotional experiences. They may not approve of it, but they're going to be there for the person no matter what. Okay, so let's evaluate the humanistic approach to therapy, both the benefits and the criticisms. First off, the benefits. This is the idea that psychological disorders result from restricted growth potential is compelling to many people. That those disorders that person has, they are the result of restricted growth potential. And now you have the potential to grow and be self-actualized. The other benefit, that a supportive environment is provided for that individual. Now, the criticisms. The treatments that are used in the humanistic approach lack specificity. It is the approach that is least scientific and the least theoretical. And it works for only individuals that can speak. It works only for highly verbal clients who profit the most from the psychoanalytic treatment. Another type of therapy is interpersonal therapy. This is a short-term therapy that focuses on the context of current social relationships. So again, it's very short-term, and it focuses on the context of current social relationships. So it helps patients control their moods and emotions. It focuses on interpersonal issues, such as conflicts that they may have with other people. It may be issues such as social skills or role transitions or even grief. The therapy lasts for about 12 to 16 weeks. That's it. So 3 to 4 months is the therapy session, and then you should be done. Remember, it's a short-term therapeutic technique. It is especially effective in dealing with depression, anxiety, addictions, and eating disorders. Those are the 3 types of situations where interpersonal therapy is the most effective. Now, I want to talk about group therapy. You may have been a part of group therapy before, or you are familiar with what group therapy entails. So I want to spend a couple of slides talking about group therapy. It is a therapy in which people meet in a group with a therapist to discuss the problems that they are having. Group therapy centers on a common difficulty. Let's say alcoholism. So everyone who meets in AA has an alcohol problem. AA, Alcoholics Anonymous, is a group therapy. It has the economical means of therapy compared to individual therapy. It is much more cost effective if money is an issue for you. The criticism is that if you're an individual who is very shy and not outgoing, you may not receive the necessary attention that you need, because group therapy is a talking type of therapy. Everyone in the group should contribute. And so if you're someone who is shy and tends not to do that, you may not get as much out of it as someone who would feel comfortable talking to others. Another type of group therapy that we have is family therapy. And this is an approach that focuses on the entire family and the dynamics within that therapy. So it involves 2 or more family members in which one or more of those family members The problems led to treatment. We also have self-help therapy. This is where people with similar problems get together to discuss their shared feelings and experiences, sometimes without any formal therapist leading the group. And so this would be an example of Alcoholics Anonymous. Alcoholics Anonymous may be led by a former alcoholic. It doesn't necessarily mean that there's going to be a therapist who is trained to be there in that situation. Where it could be a grief counseling group, right? Where people who have lost a loved one, they get together and they meet. There may not be a therapist there to lead that group. Now, during the coronavirus pandemic, online therapy was key. No one could go to see their therapist. And so they had to do online therapy in order to still get those therapy sessions. So at the height of the pandemic, almost 45% of people that were polled said that their mental health had been affected. For most of them, online therapy was the only option for them. Online psychotherapy can have potential benefits. It is very easy to schedule, and transportation is never an issue. It can also help people who lack the emotional strength to themselves get to a real-world session. It can have some limitations, though. So it's probably not the best for serious mental disorders. The therapist may have problems with correctly addressing a client's issues. And it poses both legal and ethical concerns, perhaps the privacy issues. You don't know, again, if you're a therapist working at home and doing online sessions, you don't necessarily know if someone is in another room in your house listening in. So that can cause some problems. Okay, so we just talked about various types of psychotherapy. And we want to evaluate those and figure out if therapy does work. So in 1952, Hans Eysenck published a study challenging the effectiveness of therapy. And he claimed that people who received treatment were no better off than people who did not receive treatment. So in his study, he believed that there was no benefit to therapy. He concluded that if an individual was left alone, they could go into spontaneous remission, which is this recovery process without any formal treatment. Today, though, most psychologists agree that therapy does work. There are several comprehensive reviews that indicate that it brings about greater improvement than if you do no therapy whatsoever. So let's look at this. Psychotherapy, of course, does not work for everyone. There's also no single form of therapy that works best for every situation or every problem. There are specific types of treatment that work better for specific types of problems. So sometimes, of course, it does have to become very individualized. What may work for Susan may not work for Betty. And even with Susan, she may need a different type of treatment depending on what issue she is having at any given point in time. Most of the therapies, though, share several basic elements. The development of a positive relationship between client and therapist is there. You want to develop this positive relationship. You also want to have an explanation or interpretation of a client's symptoms. And you have the confrontation of those negative emotions. Now, the next slide, this is figure 1, and you can see this at the top of page 551 in your text. And this is going to estimate the effectiveness of the various types of treatment. So along the x-axis, you have the success rate, the percentages, and on the y-axis, you have the different types of treatment. And you can see that cognitive behavioral therapy has the highest success rate, almost 90%, followed then by systematic desensitization, then psychodynamic, then behavioral therapy, and then last, person or client-centered therapy. That kind of surprises me a little bit. I thought person or client-centered therapy would have been much higher than that. I mean, it's still high. You're still at like 75% success, but I thought it would have been higher than some of those other treatment options.